Assalamu alaikum warahmatullahi wabarakatuh. Dear students, today we have another topic which is prescription writing for hypertension patients. As usual, first of all, we are collecting the biodata in which patient's name, age, weight, address, and his gender. Okay, it has no specific order whether you want to write first age or address or gender or weight. It has no specific sequence to write any one of them. First of all, in the corner we can write RX, it means to take, and the treatment for hypertensive patient is only one type of tablet we can prescribe usually, and this is lisinopril tablet. Lisinopril tablet, 10 milligram. Okay, uh, one tablet uh, daily in the morning. In the morning, but continue. It means that एक गोली रोजाना सुबह लेकिन जारी रखें. Okay. uh, in all the prescription writing lectures I have missed one thing which is very necessary for the students which are uh, giving their exams. Whenever there is prescription writing during examination, you should never miss your sign and PMDC number at the end of the prescription. It has one mark during exam. Thank you so much.